Today's healthcare environment is rapidly changing, requiring nurses to expand their roles. Nurses are being called upon to lead interprofessional initiatives, be active in care coordination, and assume other leadership roles. In order to keep pace with this ever-changing environment, the Institute of Medicine recommends that 80% of registered nurses achieve a Bachelor's of Science degree in nursing by the year 2020. Not surprisingly, BSN prepared nurses are linked to better outcomes, including decreased mortality rates, lower readmission rates, and decreased lengths of stay. In fact, a 10% increase in the proportion of hospital staff at the BSN equals a 5% decline in mortality. Another study showed that patients who received 80% of care by nurses with a BSN had a decreased odds of readmission, as well as a length of stay that was decreased by 1.9%. So let's take a look at where we currently stand. Currently, there are 2.8 million RNs in the United States. Over the past 9 years, growth in the nursing workforce has surpassed that of the population. However, while the number of RNs per capita increased by almost 14% from 2000 to 2010, the number of BSNs increased only 5% over that same time frame. Currently, about 55% of the RN workforce holds a bachelor's degree or higher. In rural areas, this number drops to 34%. In Kansas specifically, there are over 28,500 RNs. In fact, Kansas is ahead of the national average of RNs per capita. Because of the high number of nurses in the state, Kansas is in the position to lead change for advancing the entry level of education in nursing. However, as of 2010, only 65.2% of nurses taking the NCLEX exam in Kansas were BSN prepared, far below the IOM's recommendations of 80%. Adoption of the New York bill, BSN in 10, is a reasonable and effective solution to this problem. This bill requires registered nurses to attain a baccalaureate degree within 10 years of their initial RN licensure. Because this bill allows for grandfathering of currently licensed RNs, and because it continues to allow entry into the field through associate's degree programs, as long as the RN completes a BSN within 10 years of initial licensure, it is not anticipated that this bill would cause reductions in the current workforce. Healthcare is becoming increasingly complex, and the needs of Kansans must be met. Nurses are the heart of healthcare, and they must have the adequate educational preparation in order to provide high-quality, effective care. Voting members of the Kansas legislature, we urge you to consider this bill. The health of all Kansans, old or young, rich or poor, depends on it.
I need you.
We need you. Kansas needs you.